But what's so exciting to me, and I think this is the best thing to happen to suicide prevention in a medical setting, is in February of 2022, the AAP declared suicide risk screening as something pediatricians should do alongside depression screening. And they picked the age of 12 years and above, and they picked 12 to align with depression screening because that was already out there. I'm going to try to convince you that we should go down to 10, and that's work we're doing with the AAP as well. So I'm fortunate enough to be part of a research team that asked, can we save lives by screening for suicide risk in medical settings? And I think this is absolutely a great place to save lives. And the reason is, it's just what Amwa said in the beginning. The majority of people who die by suicide, and this is not just adults, but young people too, have visited a healthcare provider, not just months, but sometimes weeks, sometimes within a week before taking their own life. But the problem is they don't come in and say to the doctor or the nurse, I'm thinking of killing myself. They're coming in with medical complaints, right? So if someone doesn't ask them directly, are you thinking of killing yourself? They most likely won't talk about it. So the majority of suicide attempters go unrecognized because the majority of medical settings don't screen for suicide risk. And this is the other piece of data that came out this past fall. That there was a JAMA study showing that 60%, that's most, right? 60% of young people who died by suicide had no documented mental health diagnosis. This is the best evidence for why we should do universal suicide risk screening, why every child over the age of 10 in pediatric practices should be being screened for suicide risk.